Hare Krishna. The idea of Bhaktivedanta Medical Association originated during the working of the Devotee Care Committee in the year 2011. The committee has been working ever since to uphold the principles of care for devotees, Vaishnava Seva, as one of the three cardinal principles given by Lord Sri Chaitanya Mahaprabhu. The spectrum of devotee care includes 12 areas. First, spiritual life. Second, health care, both physical and emotional. Third, marriage and relationships. Fourth, care for children. Fifth, care in the field of education. Sixth, care for leaders. Seventh, career and employment. Eighth, financial. Ninth, housing. 10th, consumer, lifestyle, travel and immigration. 11th, legal and civic. And 12th, giving advice on mediation. Of these 12 areas, healthcare is one of the most important pillars for a healthy spiritual life. In one of his letters written in 1975, Srila Prabhupada mentioned, "It is important to keep the body fit and healthy so that we will not meet the obstacle of ill health while serving Krishna. Ill health may hinder one's service, so we want to avoid it as much as possible." Once in Tokyo, Shamsundar Prabhu was traveling with Srila Prabhupada. Shamsundar Prabhu got sick for some time then. When Shamsundar Prabhu was better, he complained to Srila Prabhupada that the devotees had not taken care of him properly. Prabhupada called an Ishtagoshti and asked everybody, "Why didn't you take care of him? We have given up everything to come to spiritual life. How can we neglect a devotee?" Then Srila Prabhupada feelingly turned to Shamsundar Prabhu and said with great intensity and emotion, "Why didn't you ask me? I would have come and nursed you." That was Srila Prabhupada's mood. He was compassionate and at the same time bold and strong if necessary. His disciples got the feeling that he loved them and that he was not exploiting them in any way. Lord Sri Chaitanya Mahaprabhu personally protected Srila Sanatana Goswami in Jagannath Puri when he understood that Srila Sanatana Goswami, due to his sickness, is having a desire to end his life. Lord Chaitanya said, "Prabhu kahe tomar deha mora nij dhan, tumi more kuriyache atma samarpan." "O Sanatan, your body is my property. You have already surrendered unto me. Therefore, you no longer have any claim to your body. Tomar sharira mora pradhana sadhan, e sharire sadhimu bahu prayojan." Your body is my principal instrument for executing many necessary functions. Through your body, I shall carry out many tasks. Lord Chaitanya Mahaprabhu personally took care of Srila Haridas Thakur by bringing prasad for him every day. Mandirer chakra dekhi, oriha pranam, eithani tomar asile prasadana. Remain here peacefully. Look at the chakra on the top of the temple and offer your obeisances. As far as your prasadam is concerned, I shall arrange to have that sent here. Similarly, Srila Ishwar Puri, the spiritual master of Lord Chaitanya Mahaprabhu, also did menial services to nurse the physical body of his spiritual master, Sripad Madhavendra. In 2008, when His Holiness Jayapatak Swami Maharaj got a stroke and was admitted in the Hinduja hospital, the devotees from the Bhaktivedanta hospital connected with the Hinduja hospital and served Maharaj nicely by facilitating whatever he needed. When Maharaj improved from the intense stroke phase to that of physiotherapy, he was shifted to Bhaktivedanta hospital where he stayed for 2.5 months. The Bhaktivedanta hospital took special care to make sure that all of Maharaj's needs are taken care. The bathrooms and toilets of the hospital were small for him, so the hospital broke one toilet and created a jumbo toilet. Maharaj was paralyzed totally on one side with his face and one side of the body immovable. So the physiotherapy department headed by Dr. Chako took extra care to provide the best treatment for Maharaj so that he recovers as soon as possible. Constant kirtan in the hospital, the deities of Jagannath, Baldev and Subhadra coming for giving darshan along with prasadam arrangements made Maharaj feel at home. Furthermore, Bhaktivedanta Hospital doctors were in constant touch with doctors of other hospitals to provide the best treatment. So we can see how important caring for health of devotees is, especially in this phase of ISKCON, when a major section of ISKCON devotee population is moving towards a higher or older age bracket. More so, the ongoing pandemic has thrown yet another challenge to provide healthcare support to devotees that is customized to their needs and spiritual practices. There are 1.3 billion smokers and tobacco consumers, 2.57 billion alcohol consumers and 1.9 billion individuals fighting acute obesity in the world today. With malnutrition numbers growing as high as 52 million individuals, the economic burden from such diseases costs upwards of US $600 billion annually. Together, the economic burden on the world created amounts to USD 4.8 trillion annually. Additionally, mental health causes a disability in 1 out of every 5 people in the world. This number has increased to over 1.1 billion people suffering from mental illness in the past 4 years. Mr. Devi Prasad Shetty, Chairman and Managing Director of Narayana Health, in accordance with the EU Medical Agency, speaking at Microsoft's Future Ready conference, reiterates that 95% of illnesses will be treated by telemedicine, with the patient sitting at home, in car, in office or even in their bed. The future of healthcare delivery is telemedicine. The physician-patient ratios across the globe are as follows. In Africa, it is 1:3,623. In America, it is 1:353. In Southeast Asia, it is 1:1147. In Europe, it is 1:232. And in Eastern Mediterranean, it is 1:914. And Western Pacific, it is 1:531. There are 4.46 billion living in the urban areas and 3.42 billion lives in rural areas across the world. There is less penetration of allopathic medicine in the rural areas, and hence, to curb the fear of long-term side effects of allopathic treatment, integrated medicine is also required. Integrated medicine eases its ways by advocating the traditional practices of Ayurveda, yoga and diet and nutrition, along with the swift action, diagnosis and prognosis with respect to allopathic medicine. To continuously reinvent and build the healthcare portfolio of the Devotee Care Directorate, a dedicated team of world-class healthcare professionals were identified in 2021 from within the devotee community to form a Bhaktivedanta Medical Association under the leadership of Dr. Sanjeev Agarwal. This committee initiated its working initially on physical healthcare part and has included the mental and emotional aspects of healthcare by involving experienced psychologists, psychiatrists and counselors, among others from across the world. The current strength of the team is more than 100 members dedicated to serve quality healthcare to devotee community from across the world. The Bhaktivedanta Medical Association focuses on 4 primary objectives. First, to identify healthcare resources, including professionals, collaborations and knowledge repositories globally, and make them accessible to the global community. Second, to publish healthcare resources of various categories for guiding ISKCON leaders and devotees. Third, to develop websites with all the relevant information for helping devotees across the world with their healthcare crisis. And fourth, to especially create awareness about alternate healthcare options such as Ayurveda, naturopathy, yoga, homeopathy, etc. Today, I am pleased to share with you about the launch of the digital healthcare initiative of the Bhaktivedanta Medical Association, www.bma.healthcare, that will provide holistic advice and guidance through articles, videos, content with experts from all disciplines including allopathy, Ayurveda, yoga, diet and much more. This project aims to serve devotees in a way never done before by providing advice and guidance in all aspects of health and well-being on a digital platform. I extend my best wishes to the entire team who has worked tirelessly in the past months to realize this dream with a strong intent towards serving the Vaishnava community, with a strong intent towards serving the global community. The virtue of care through Bhaktivedanta Medical Association will pervade all aspects